Hi, everyone. We're going to get started. If I could have everyone's attention, please grab a seat. This will take a minute. Yeah. Here we go. That was good. That was good. Thank you, Sharon. Hi, everyone. Good morning. Boker Tov. Thank you so much for being here and accommodating with our changing of the time a little bit. We're so happy to have you all here. I think I know everyone, but in case I don't, I'm Cantor Cohen. Hi. And before we introduce our wonderful speaker for the morning, I just wanted to share a few announcements and things that we are thinking about. Of course, we have a lot of programs going on at the temple, but I just wanted to let you know that for anyone who wants to do some Hanukkah shopping, we will have the Hanukkah store that's normally on Sundays with our religious school set up especially for you in the hallway or the lobby right after our program today, so you can get any of your Hanukkah needs, courtesy of Jen Jaffe. And, of course, our Shalom Shishim Hanukkah party is going to be on Tuesday, December 12th, in a few weeks, and we'll have a very special concert and Hanukkah food, and it's going to be a wonderful time, so you can register for that online. There's many other events going on this week with the Sisterhood and Men's Club and other Hanukkah events, as well as, of course, Israel-related events and rallies. Every Sunday there's a rally downtown. There's going to be a big community-wide gathering in front of the art gallery on the first night of Hanukkah in partnership with Chabad. So that should be a really beautiful coming together moment of our community. And if you are interested, I will be going back to Toronto to do a cantorial concert on November 30th that will be raising money for Israel, and it's going to be a Hanukkah concert as well. And you can watch virtually and get tickets, which all the proceeds go towards Israel online. So let me know if you have any questions about that. And it felt appropriate, bye Bill, bye Bill, to think about our community in terms of course, we always want to celebrate the simchas in our community, but we've also had some sadness and some loss, and I wanted to acknowledge that. We are remembering Michael Jacobson, husband of Estelle, who was a really big leader in our Shalom Shishim program, at least since my involvement with Shalom Shishim. He came up with so many ideas and speakers that we have had that have been amazing, including our speaker today, Dr. Lara Boyd, and we owe him so much and are just so grateful for him and for you, Estelle. So we remember him for a blessing. I also wanted to mention Dr. Earl David Hardin, who we've lost recently, Sanford Cohen, who many of you know, and if anyone else has someone that they wanted to share the names of, you can let me know. And we can just take a moment in our hearts to remember them and honor their memory. With that, does anyone have any birthdays or anniversaries or simchas that you want to share? It's been a while since we've been together. Yes, John. Next Sunday, your anniversary. Wow, that's wonderful. Mazel tov, mazel tov. Anyone else? Yay. Birthdays, anniversaries, you don't have to give a number. Okay, well, then we'll say, John, this is for you, and Alexine. Hope you'll join me. Wise men say only fools rush in, but I can't help falling in love with you. Shall I stay? Would it be a sin if I can't help falling in love with you? Like a river flows surely to the sea, darling, so it goes. Some things are meant to be. Take my hand, take my whole life too, for I can't help falling in love with you. Like a river flows surely through the sea, darling, so it goes. Some things are meant to be. Take my hand, take my whole life too. Let's hear you. For I can't help falling in love with you. Last time. For I can't help falling in love with you. Okay. I just have to say that just about a month ago, can everyone hear me okay? Hi. I know we have some people coming in. It's all good. Just about a month or maybe 2 months ago, I got a handwritten list from Michael Jacobson with some singer-songwriters that he thought would be good for me to use as our opening songs at Sholom Shishim, and Elvis was on it, so there you go. That was for Michael and for John. So it is now my pleasure and honor to invite Dr. Lara Boyd to be our speaker for this morning. Dr. Boyd is a physical therapist and neuroscientist at UBC, where she is a professor, Wall Scholar, and fellow of the Canadian Academy of Health Sciences. She is an expert in the neurobiology of learning and uses advanced brain imaging approaches to look into the brain. Dr. Boyd's research is centered on understanding how behavior shapes learning, unlearning, and relearning. She has published more than 200 scientific papers, and her TEDx talk, After This, Your Brain Will Not Be the Same, has over 38 million views. So let's welcome Dr. Lara Boyd.
Super. Got to go up with this one. Thank you so much for inviting me today. And I sincerely apologize for the time change. That's UBC's fault. So I have to be in a meeting at 1, and I couldn't figure out how to get across town in time. So I hope this is going to be an all right time for you. Yeah, I know. Is that okay? It sounds really loud to me, but... Oh, okay. Thank you. Before we start, I just wanted to extend the invitation for you to ask questions as we go along. So I kind of feel like I'm here to just kind of share my brain with you, whatever you're interested in. So if I bring something up and I'm not clear, or you want to ask a question, want me to elaborate, please jump in. We can take questions at the end too, but sometimes it's more fun if we address them as we go along. So let me just start off by showing you my brain. So this is my brain. Most of the examples I'm going to show you today are actually my brain because there's no confidentiality there. I don't mind. And I just want to start by pointing out a few things about this brain. So first of all, it's beautiful, yes. So your brain would be equally as beautiful. What I'm showing you here are all the connections between individual groups of neurons or brain cells in my brain. And so this is a technique called diffusion imaging, and it allows us to basically capitalize on an MRI's ability to track water molecules as they move. So these water molecules move down our brain cells, our axons, as they connect different parts of the brain. And we come up with this very rich, it's basically a wiring diagram, right? If we were electricians, we could try to rewire it. And what these colors are showing you is the direction of those fibers. So this would be as if I cut off the front of my head and you were looking straight in. So these blue, this is the spinal cord coming down out of my brain. So blue fibers are up and down. The red fibers are side to side. And so this big structure here, this is called the corpus callosum. It's connecting the two sides of the brain together and sharing information across. And then lastly, the green fibers would be ones coming forward and back. So you get kind of this rich idea. And the only reason I show this is just really emphasize the rich connectivity of the brain. And then by way of that, to share with you that this connectivity is changing and is basically a representation of what we're doing, what we're practicing, what we're thinking about. And that we now understand that that change is happening basically from the moment we're born until the moment we die. Our brains are just constantly reorganizing, changing, adapting, elaborating, shrinking. And that's somewhat new knowledge. So when I was a graduate student, I have a bunch of degrees, mostly because I was unfocused in my 20s. I kept going to school. I didn't know what else to do. So my first degree is in English literature, because I was going to be an English professor. I know. So it's kind of weird. And then actually, I was a basketball player, because 6-foot-tall woman, it's kind of like required. You can play basketball or volleyball. Those were my options. So as a basketball player, I hurt my knee very badly. So I thought, oh good, I'll become a physical therapist. So I did that for a while. And I really didn't care for it, mostly because I felt like I couldn't make my patients better. I couldn't help them enough. I felt like I was a mechanic, and your car broke down, you brought it to me, we popped open the hood, and you're like, can you make it, can you fix it? And I'd be like, oh, that engine's kind of cool, I have no idea how it works, right? And you can't fix something if you don't understand how it works. So after a few years of physio, I went back and I did my PhD and in the very new field of neuroscience. So where I was going with this whole story is that when I did my master's degree, I graduated in 1992 with my master's, we didn't think the brain changed. We were taught that it changed kind of up through puberty, then it was pretty fixed, pretty rigid for the rest of the life. And basically, we were taught you were just losing neurons from like age 12 or 13 on. It's like we all thought, you were over the hill when you were 30. Then you turned 30 and it had to be 40, right? And then you turn 40 and now it's the new 40 is 50, which I like a lot. I like this idea. And so That's actually absolutely untrue. When I was early in my PhD in around the mid-90s, we started finding this evidence that the brain was changing. It originally came from animal studies, and then we were lucky enough to be able to start using technology like this. So in the late 90s, we now began to have access to things like MRI machines and the capacity to use them to look in and see the brain changing as people learned, or after they hurt their brain, or as they developed. And so this is the tool that is really kind of the most important tool that we have right now to understand the human brain. So this is our new MRI at UBC. We put this in, and I believe it came online in 2018. We just about had it working before we shut it down for the pandemic. And yeah, that's the irony of that. So we have a beautiful new imaging center in the basement of the Center for Brain Health on campus. And this is one of our tools in there. And it allows us to do stuff like I was telling you about with my brain. This is a diffusion scan. And then also to look at different brain structure. And so one of the other things we can do in addition to these kind of structural images is we can also look at the function of the brain. So we can look in there and we can look at how brain activity is changing as people are performing a task or before and after they've learned something. And then we're able to derive what brain regions are important for that particular task and what's happening while people are learning or recovering or developing. So these are our really key important tools. What I'm showing you here, this is what we call a functional MRI. And these bright areas are areas of increased brain activity in association with I'm having this patient in my lab, they're doing a finger sequencing task. And so we look to see how the brain regions are changing as they acquire skill. So those are kind of the basic tools, or one of the basic tools we use. So I want to kind of start off by just talking you through, well, how do we learn? Like when we learn something new, what happens in our brain to allow that? And so because of these studies that were happening in the 90s and have continued on to today, it's very clear that when we learn, we change our brain. So it's my favorite thing to say, and if you watch my TED Talk, I say it in that too, but when you leave this room today, your brain will not be the same as it was when you came in. So by being here this morning, you have changed your brain, and hopefully for the better. I hope so. Hopefully you learn something that's interesting, and maybe you change the behavior you're going to engage in your daily life. But this is what we call neuroplasticity, this idea that learning new information, learning a new movement is changing our brain, and this is constantly taking place. So the other neat thing about this concept of brain change is the single largest driver of change in your brain is your behavior. So what you do, what you engage in, what you choose to spend your time thinking about, that's going to shape your brain much more than any drug you might take. So the drug companies have tried very hard to develop a neuroplasticity drug. And the fact that we didn't all take one this morning shows you that they've failed, right? Because who wouldn't want to be a better learner? There's actually it's actually possible to have too much neuroplasticity. We'll talk about that later. But so there's no particular drug that will drive this. There's no stimulation or kind of external device we can put on and drive you to be more neuroplastic. We can kind of nibble around the edges and help a little bit, but nothing really comes to the same effect as our behavior. And so we call it behavioral dependent neuroplasticity. And so this is what my group studies at UBC. So what's that relationship between our behaviors and learning and then our brain? And can we leverage those things to make our brains healthier and keep our brains as good learners as long into life as possible? So when we do learn, what is actually changing in our brain? So we're changing basically three main things when we learn something new. So we're changing our brain chemistry, we change our brain structure, and then we change our brain function. And all of those things are happening together, but at slightly different time scales. So that kind of explains how we learn what and when. So let me explain what I mean by that. So when we rapidly learn something new, first time you get exposed to it, maybe today was the first time you heard the word neuroplasticity. Although probably not, because we neuroscientists, we're having a moment. We're kind of cool right now. My mom finally gets what I do. It's taken a while, but we're there. So when you heard the term neuroplasticity, you very first time you encode that word, the way your brain does that is by changing its chemistry. So to understand this, you have to kind of understand how our brains actually work. So we have neurons, brain cells, and we have a whole lot of them, trillions. And for those neurons to send information across from neuron to neuron, they somehow have to be able to pass an electrochemical signal. And what's kind of neat about our neurons is they come very close to each other, but they don't actually touch. They come very, very, very close, but they don't truly touch. And I kind of think of the neurons as looking a lot like trees, and this is an example of them. So these are neurons in our motor area of our brain, neurons that help control movement. They're called pyramidal tract neurons. You have this big cell body, and you have this long trunk going out. That's called the axon. That's the projection going to the next neuron in the chain. And then you have, I don't know if you can see these kind of fine hairs coming off it. They're like branches. These are called dendrites. And at the end of each of these branches is where those dendrites from one neuron are going to come very close to the dendrites of another neuron. So when we learn something new, we need to pass a signal through along those neurons. The first thing that happens is we increase the chemical concentration in one neuron, and then it sends those chemicals across to the next neuron. They send it across something called a synaptic cleft. They go across, and when those chemicals hit the next neuron over, it activates that one, and you can see the chain reaction gets set off. So it's this chemical transition. So this is important because changing chemistry can happen really quickly. In the order of milliseconds, we can change these chemical concentrations. And so we think that this is actually the basis for forming a short-term memory. So a memory that you have that's kind of elusive. It's not really become encoded so that you can call it back later. So we all know these short-term memory. We've all had this experience. So I'm going to make a confession to all of you. I'm super, super bad with names. In fact, thank you for wearing name tags. It's like my dream. If everyone just wore a name tag, it would be awesome. So last night I was at this event at UBC, and I met tons of people, and I know this is going to happen to me. I'm going to walk into a meeting, and I'm going to be like, I know we met. I can't remember exactly where, and I definitely don't remember your name, but I know I met you. And then I go through this checklist, like, did we meet at work? Were you at my kid's school? Does your kid play soccer with my kid? Do you work at the grocery store? And if someone's out of context, then I'm totally swamped and lost. But I will recognize that at some point in my life, I've seen you. So forgive me. If I see you out in the community, please introduce yourself. And I'll be like, oh my gosh, I'm so glad to see you again. But I won't recognize you at first. Something's wrong with me, I think, but that's one of my problems, one of my blind spots. So what my problem is that I make this short-term memory. My chemical concentration goes up. At dinner last night, I knew everyone's name at my table, but if I see them today, it's hopeless. So I've made this short-term memory, but I've not transferred it into long-term storage so that I can call it back later. Now I'm really good at other things doing that, just for some reason names, not my jam. So these short-term memories are created by this change in chemistry, but then through practice, we actually have to change brain structure, and that allows us to make a long-term memory. So this is just an example here before I move on. This is one of my patients at UBC. We've put them in the MRI, and we actually can measure the chemical spectra in the human brain. So we can actually see this process in real time. And so this individual has actually had a stroke. So if you look here, this is a frontal slice. So again, if you slice the front of my head off and you're looking straight in, you can see here on the right side of this person's brain, this bright area is showing us fluid, and that's actually a bleeding stroke in this individual. So in this particular study, we wanted to understand how stroke is affecting chemicals in the brain that are known to excite neurons, and that's what we were studying here. And we're just able to show that not only stroke, but actually the severity of the stroke is shifting these chemical signals, and it gives us evidence to understand that after stroke, it's hard to move, in part because you've had damage to your brain, but also because you have less of these excitatory chemicals available to you. So you have kind of a suppressed chemical system. So that's something that's valuable information, because you might be able to shift that either through behavior, maybe brain stimulation, maybe a drug. So that's one way that we can apply this work. So short-term memory, we've changed the chemistry in our brain. Now, to make that into a long-term memory, we actually have to change brain structure. So if I had repeated exposure to all of you, I got to come here every Tuesday and we had lunch, I would eventually learn your names. I just need lots of practice. So for that to happen, though, I would actually have to create new connections in my brain. Now, that might happen by adding more of these branches, more of these dendrites. That's one way that could happen. As we practice and get good at things and we add those dendrites, we can actually see an enlargement of the brain areas that support those behaviors. So we started with a beautiful song. And so people who play the guitar, they actually have a larger hand representation on their fingering hand than those of us who are hopeless. That again would be me. I'm not musical, but I love music, and that was one of my favorite songs, so thank you. It's a beautiful song. So that's one example of how practice is actually changing the structure of your brain. So musicians have particularly unusual brains. In fact, often we throw them out of our studies because they're so different than those of us who are non-musical. So pianists actually have the ability to dissociate the two sides of their brain. And that's how you can do these elaborate things with your two hands that are very different at the same time. So that's another example of that. And you will see these very large hand representations in people who play the piano. Likewise, people who are very good at spatial navigation, so for example, taxi cab drivers, have very, very large brain regions devoted to spatial mapping, which is really interesting. That brain structure would be that your hippocampus on the right side, very specifically, will be quite enlarged in those folks. So this is an example of how brain structure then changes with practice and repetition. It's something we've also looked at quite a bit in my lab, because the other thing that's happening to support these structural changes when we learn is by changing a very specific structure in the brain called myelin. So I know you didn't know you were taking a crash neurophysiology course this morning, but I'm gonna make it seem so cool that you're happy you did it. So we have lights on in this room, right? And every electrical wire that we have is wrapped in insulation. So these wires that go into these lights and this microphone, and even you can see the cable from my computer, it's insulated. That's to keep the electrical signal from decaying and getting smaller as it travels. So our brain does the exact same thing. So if you look here at these long projections, they're called axons. These projections are actually wrapped in insulation. It's called myelin. It's made by a cell called an oligodendrocyte. It's a really cool and dynamic cell. And that allows the speed of the transmission of the signal down that axon to be controlled. So what's really neat about this is some work from my lab. We discovered that as you learn something, the thickness of that insulation will change to control the speed at which that information travels. So in this instance, people were learning a new game in my lab. So we have this virtual computer game that we've designed that we use to kind of trick people into doing stroke arm rehabilitation. So the game is that you're in front of a computer and an asteroid is flying towards the Earth, and it's going to hit the Earth will blow up, and we will all die, which is bad. And so your job is to control with your arm a spaceship, and the spaceship has to catch the asteroid, and then we used to have it blow up, but then we were told that that was very violent, and we shouldn't do that. Even though it's an asteroid. It seemed logical, but that was the 2012 thinking. 2023, we now put it into a mineral extractor. It gets sucked away, and we can use the minerals from the asteroid. So we're progressing. It's actually really cute. It makes this great sucking sound. It's a fun game. So we had patients playing this game, and what is the neat trick is because they're catching this asteroid, it's always kind of just a little bit farther than they're comfortable reaching. And so before you know it, you're reaching all over the place with your stroke-affected arm. What we discovered was that by playing the game, people significantly increased the thickness of the myelin in a brain region that's important for integrating vision with movement. It's an area called the intraparietal sulcus. So it was really exciting for us to show that where it can even change a structure in just a few sessions by this myelin elaboration. Yeah?
If your myelin increases while you're doing the game, if you stop the game, does it go back to where it was?
Absolutely. So the question was, if it increases during the game when you stop, does it go back? Yes. So the hope, though, is with our stroke patients, is that they've lost myelin because they have this impairment. And we know from other data that after stroke, even in the rehabilitation hospital, people really don't use their arm very much. When you're in rehab after stroke, the real focus is getting you safe in and out of the bathroom. Once you can do that, hit the road, Jack. I mean, that's the big inpatient concern. And there's not as much done for arm. So this is one reason we developed this game, is because the idea is, okay, so we've gotten you safe with your mobility in rehab, but we want you to work on that arm. So take this game home. We just got a grant, and we're designing them on laptops. So you leave the hospital, I hand you this laptop. You're going to go home and practice this rehab, start to get your myelin back. Now, oh my gosh, not only can you catch asteroids, you can open doors, you can reach out on the counter. It's just easier to use the arm, so you'll kind of hopefully keep doing it. It increases over time from use. And the idea here is a jump start, yeah. So that also means, though, because you made my point for me, not only does it increase with use, it decreases with non-use. So we know there's this kind of use it or lose it phenomenon in terms of basically all of these things I'm talking about, but myelin seems to be sensitive to that. And someone had a question in the back. Yeah, that's a wonderful question, the relationship between the brain and muscle memory. So we think that a lot of initial muscle memory is actually brain. And when people will start, for example, to train, like even weightlifting, for the initial probably 20% of strength increase, the muscle doesn't change. It's better neural control. For muscle memory per se, it's probably both brain and spinal cord. So we have a tiny bit of a problem with humans. It's very hard to image the spinal cord. We think change is happening there too, but our spinal cord it's about as big as your thumb. So it's really tiny, and it's in this protective spinal column. So it's around, within bone. And so it's quite tricky for us to image it in MRI. We're actually working on that right now at UBC. I have a grant with a friend from the States in spinal cord injury, where we're trying to do some imaging and understand that. But we think the two are highly related, the muscle memory. Then as you continue using, you will see the muscle changing as well. And these things they're going together. Yeah. So there was, oh yeah, no.
How similar and how different is learning skills using your arm after cerebral tissue loss compared to learning facts, remembering names?
Right.
Because they're both a concern in aging.
Yep.
Memory for everyday things, memory for new people, and of course, motor skills and
Yeah.
how are they similar and different?
So the question was, I just want to repeat in case you couldn't hear on the other side. The question was, how similar is learning a movement to learning a fact or remembering data and details, and especially as you're aging? So the basic processes are exactly the same. So these ideas of chemical for short-term change, chemical changes for structural changes with time, it's the same kind of basic neurobiology. It's happening in different parts of the brain. So yeah, so our motor areas, in part, I study motor areas for a couple reasons. One, I think my background in physio and sport kind of leads me there. The second reason is it's a lot easier. So the motor areas are quite large in the human brain, so they're easy to see. Our memory centers are very small, largely focused in a deep brain region called the hippocampus. So if you stuck your fingers in your ears and you went in about that far, you'd hit your, don't do it, but you could. You'd hit your hippocampus. So there are these we have these deep memory centers in our brain, and they're richly connected with the prefrontal cortex, the front part of our brain. And that seems to be where our cognitive memories, facts, your phone number, those kinds of things, your address, are stored. And those brain regions are changing in the same way. They are, for whatever reason, much more susceptible to disease in terms of like a dementia as compared to the motor areas of the brain. And that is a really interesting kind of puzzle for neuroscientists. So there's no such thing as a motor dementia, right? We don't forget how to move. In part because we have, our motor centers are really distributed. We have lots of them. We have motor areas up top in the brain. We have motor areas deep in the brain, the ones that are affected by Parkinson's disease, the basal ganglia. We have this big cerebellum in the back of our brain, and all of those are really important for movement. The memory centers, the hippocampal areas, are small and focused. So they could actually be damaged, and you can have an amnesia, right? You lose the ability to make a memory or to remember things from the past. So it's interesting how they're organized differently, and damage will affect them differently because of that. Let me circle back to this if that's okay. I want to make one more point about this. One of the things that we've found in this work on myelin is that people who learned more slowly actually built more myelin. And so what we looked at was a relationship between the difficulty of the task and the speed or the rate of learning. And so people who made more errors and had a slower rate of learning were the ones who showed the largest improvement in their myelin. And so that suggests to us that it's actually very important when you're learning to be trying to do something that's quite hard. So it's this idea that struggle during learning is actually very healthy for the brain. That's when you're actually stimulating the most brain change. So we actually we think about this in my lab as the Goldilocks experiment. So, right, so it can be too easy and you're not learning anything because you don't need to. You have enough brain to accomplish that task. It could be too hard and you just can't do it. So you're also not learning. And so what you want to be is in that kind of just right zone, where it's hard but accomplishable. But it should be a struggle. It should be quite hard. If something's not difficult, you're probably not making a lot of brain change. And we've seen this now in a couple other experiments as well in different ways. So we feel kind of confident that this difficulty level is quite important. So it's something we've built into kind of the different games and tasks that we use in my lab to probe learning, is that we're always trying to make it. So you play my asteroid task, you should miss it probably 3 or 4 times out of 10. It should just be not catchable. So we want to keep stimulating you to try harder. And the same thing applies to cognitive skills too. You want it to be quite difficult, which I was just telling my 17-year-old as she was doing her calculus, and I don't think she appreciated the advice, but it's true.
So, I read a lot of articles. I'm always on my computer, and there's all kinds of articles, very different sort of things that range from, cooking to topics like yours, for instance. And I'll just, constantly be reading. What does that do to the brain if you're reading a lot?
So reading, you're basically, the question is what's happening to your brain when you're reading a lot and reading a lot of different things. So you're basically challenging your brain to understand a wide range of topics through reading. And it's an outstanding thing to do for your brain health, is to be constantly engaged in new information. So it's actually a very, very positive thing to be engaged in. So you can kind of take it a couple ways. You can, do a deep dive on one topic or a broad appreciation of many things, and they're both very, very helpful for your brain.
So I have one other question. What does pain, the experience of pain do with the brain?
I'm going to come to that. I'm going to have you hang on to it, and if I don't answer that well enough, then ask again. Yeah.
With regard to people who have short-term memory issues, I'm aware of someone who, if you ask him a question, cannot retrieve the information. But in another day, he'll talk about that very same information. Now, why can't that be retrieved?
Yeah. So people who have short-term memory issues or mild cognitive impairment, that's a very common scenario. And I honestly don't think we fully understand why sometimes you can access that information and other times you can't. Or there may be time of day effects, where some times of the day you're better at that than at other times. So it's a really interesting phenomena. Sometimes what can be done would be to trigger the memory through some kind of a cue or a memory aid, just to kind of start to get it going, and then those processes will come along. But typically that is associated with small amounts of damage in the brain, either from like an Alzheimer's type pathology, that's a chemical disorder, or a lot of short-term memory loss actually comes from people having very small strokes. So what we call microlesions. And these very small strokes will accumulate. Many of us have them. They're a feature of aging. They just kind of start to happen in our brain as we age. But they seem to be, if they accumulate to a certain point, then they will begin to affect behavior. Where that point is and what that could you measure, it's when you get to 17? We don't really understand that. It seems to be very different from person to person.
Somebody who sustained neonatal meningitis and then a head injury.
Oh, okay. So you have a pathology, yeah. So meningitis and then a head injury. So that would account for that. Yeah. It happens in these kind of small lesions happen in quite a few of us as we age. They relate often to high blood pressure or high cholesterol, those kinds of things. And so they can be stabilized or reversed through exercise. And that's work that my colleague Teresa Lee Ambrose does at the Center for Brain Health, looking at these kinds of interventions to slow cognitive decline. Yeah.
Have you seen any correlation between illness and the brain? For example, cancer or heart attack. Is there a connection between those occurring in the brain, or are they separate?
So no, you will see change in brain after many different things. So anything vascular will affect the brain. So heart attack is very common in having a side effect of impacting memory. So anytime there's been a disruption of blood flow, our brains do not like blood flow to be disrupted. Any kind of like anoxic event where you stop breathing, or a disruption, or even just poor blood flow, poor perfusion, maybe your heart's not working as well as it should, you have a valve that's leaking, something like that. So those are very related. Cancer, certain types of cancer like to metastasize to the brain. Typically breast, prostate cancer, as they become advanced, will metastasize. The brain is really interesting in a way because it's protected by something called the blood-brain barrier. So it's in a protective sheath, and actually most things can't get into the brain. It actually can be a problem. It's why it's hard to get a drug to the brain if something happens, if you have an infection. Or for example, in Parkinson's disease, we know people need more dopamine and it's very hard to get it to the brain because of this blood-brain barrier. So this has been one of the puzzles for scientists around long COVID, because we know the brain's affected in a certain percentage of people who've had COVID, and they show these long symptoms. And there's a real active debate about whether or not COVID can get into the brain. Or are we seeing COVID causes inflammation, and that inflammation affects the brain? I'm not sure that we understand the answers to those questions yet. There's been a tiny bit of suggestion that COVID, the virus, can actually get into the brain, but it's not been a sustained finding. And I don't know that I'm convinced just yet if that's happening. Early in COVID, we thought maybe the virus was going up our olfactory nerve, right? Because we lose smell. That shows you that the virus is in your olfactory nerve. And that comes right to the base of the brain through what's something called the olfactory bulb. So we were very worried that maybe COVID was getting in the brain. But there haven't been a lot of really great studies continuing to show that. Now, COVID does cause a lot of inflammation. That explains some of the heart symptoms. And we think maybe inflammation is then the reason for this long COVID. But that's the other one that we worry about, that relationship. And there's a lot of research in that area. We don't know yet. I don't know yet for sure.
I wanted to understand better the relationship between the thickness of the myelin and the task that you're doing. Is there like a certain minimum that has to be there to make the connection to perform the actions? But why does having more help?
Right. So that's a wonderful question. So why does more myelin help in this particular task? Because it's a speed-based task. So it allows you to react faster to reaching out. So I wanted to circle back to this. So myelin can both increase and decrease, and both can be good. It turns out to be quite complicated. The best way I think I can describe it is thinking about you're driving across Vancouver, and you've got traffic going both directions, right? So there's some times where you want traffic to slow down because you're coming to a red light. People are going to go this way. And there's other times you want traffic to speed up, so you get your green lights, so you keep going. That's kind of what myelin's doing in the brain. It's having brain signals from different places arrive to wherever they're going coincidentally at the same time. So you want to have this kind of coordination of signals. And so in this example, in tasks that involve where speed is better, you'll see myelin increase. But there's other examples of where maybe you don't want things to happen as quickly, and you'll see myelin decrease. And so what's neat about it is it's just changing all the time. It's increasing and decreasing in real time.
I just have a follow-up here. So I mean, my understanding is limited, but, I understand the role of myelin and how the transmission along the nodes around it, but I'm not sure I understand why the thicker, as opposed to just having myelination, like, does the signal degrade?
Yeah. No, it's a great question. I was trying to avoid, but we can do it. It'd be better if I could draw it. So the way myelin works, I have to back up just a tiny bit, is you have this, think of this long tube and you want to insulate it. So it's not just like one smooth insulation. What it does is each of these individual cells is they're wrapping themselves dynamically around the axon. And then actually your nerve impulse skips from bump to bump. Those are called your nodes of Ranvier. So you could have a lot of little bumps, and so the action potential, the nerve conduction is making tiny little skips, or you can have great big ones, and it just makes a few skips. And so by thickening, it's making bigger nodes of Ranvier. It moves faster through fewer skips. It's actually very elegant. It actually goes both. As it gets wider, it gets taller. And if you're really interested, I can show you a colleague of mine has done these beautiful real-time images of the oligodendrocytes wrapping and thickening and thinning, and like they're amazingly dynamic structural creatures. So it's just changing constantly. The reason why you maybe have heard of myelin and we worry about it is it's the structure that's affected by multiple sclerosis. So in the autoimmune disease multiple sclerosis, our body attacks our myelin. and degrades it so that these impulses can't travel at all in some instances, right? And then you have very severe deficits. Because myelin can change like this, what you see in multiple sclerosis, if you know someone, or there's probably someone in here who has it, my brother has multiple sclerosis, you'll have these periods of relapse, things get bad, the myelin degrades, and then remission, it comes back. And that's the oligodendrocytes becoming sick and then coming back. And so that's why you get this kind of yo-yoing of the symptoms sometimes in certain individuals. Yeah. Yes?
There are courses at UBC, I believe, I've got emails on that there's some kind of courses at UBC regarding brain plasticity and things like that. Are you involved in that?
So I'm not involved in any of the public-facing courses. I do lots of talks like this today. I teach this content in my students' courses. So I teach a graduate seminar in imaging, and I teach neuropathology in the med school. So those courses I'm part of. But I know that we often will have public seminars, and there's, I should give a quick plug to the Brain Wellness Program and the Center for Brain Health, which has exercise classes, dance classes, courses, and talks. I'm giving a talk about brain and art in a few weeks through that. So that's a great resource if you're interested in more and different speakers. And I believe those are all online now also, so you can come in person or you can just Zoom in, because we're trying to be able to make things like that accessible to the whole province, whether or not you're here in Vancouver, right? So, yeah. Okay, I'm going to keep going. Oh, yes, I'm so sorry, I didn't see you. Oh my God. Okay, I'm going to have to skip ahead. One quick question. Mm-hmm. Yep, that is possible. I don't do any of that kind of nutritional, brain nutrition work, but again, the Brain Wellness Program at CBH has those elements. Mm-hmm, mm-hmm, yeah, yep. Okay, I promised I would talk about pain, so I'm going to go ahead. I want to just maybe remind you all, this is kind of one of my summary slides. So all of our brains are neuroplastic. You see the brain changing all the time. And the only other thing I didn't tell you in that bit back there is your brains are never at rest. So even if you think you're not doing anything, you think your brain's turned off, it's not. Even if you're having one of those moments, you've all had a moment in the time I've been speaking where you realize you stopped listening, right? It's okay. That's called, our brains do that. That's a normal part of brain health. It's called going to default mode. And we see a very stereotypic pattern of brain activity when you do that. So it's almost like your brain taking a break, and then you come back. And your brain's actually not at rest. You're not zoned out in that moment. You're actually going to this default mode, just having like a brain breather, and then coming back into the topic. It's a really interesting period of time. Some people think that this is when we have spontaneous creativity, that like, oh, that aha moment, that almost always tends to happen when you're in this default mode state. So you don't have to feel bad if you stop listening to me for a few minutes. That's okay. I do want to skip ahead to this really quickly because it came up. And I want to point out that not all neuroplastic change is positive. So we're talking about it like brain change is awesome. And it is if you want to learn something. But we have these examples where brain plasticity is not great. So if you have like a repetitive use injury, chronic pain, drug and alcohol addiction, and then stress and anxiety are examples where this can be negative. So one example of how pain affects the brain comes from a study of chronic back pain. And what we see in people who have chronic back pain is that not only is their brain hyper-responsive to their back, so if you touch their back, you see this exaggerated response in the sensory areas of their brain, but you have a brain that overinterprets almost all sensory experience. So even if you touch their hand, and it's not a painful touch, you see an exaggerated brain response. So it's an example of how pain can really change the entire cortex, change the whole top of the brain. And the other bit I want to just talk about really quickly is our response to stress and what that does in our brain. So when we're stressed, our brains release a hormone called cortisol. And so cortisol is actually a quite normal part of our human chemistry. So everybody woke up this morning because our cortisol level went up. So was anyone in here lucky enough to just wake up on their own? Okay, well, you guys are really lucky. So the rest of us were shocked when our iPhones started ringing, and it was still very dark outside. That was me. And I hit snooze like 4 times and had to hurry through my workout, but it was totally worth it. So when that happens, when your iPhone goes off and you're like, oh my gosh, it scares you a little bit and you get this big hit of cortisol. Or if you wake up normally, it's because your cortisol level has risen. It wakes you up and then it slowly decays through the day, the whole day. So cortisol is actually really good. It helps us regulate sugar, helps regulate blood pressure. It gives us arousal. So like if you're kind of nervous, but like that good nervous, like you're going to take a little test or run a race, like that's helpful. And it actually can help our memory. So if you're studying for an exam and you're kind of a little stressed about it, it can enhance memory. So the problem that we get into is when we're stressed all the time. Our cortisol goes up and it stays up. It doesn't get to come back down through the day. So that's a stress cortisol response. And what this can do to us is it will impair cognition, it impairs sleep, it can mess up our sugar balance in our brain, our insulin balance, decrease bone density, decrease muscle tissue. It can decrease your immunity, and it can mess with your cholesterol. So you have higher levels of the bad cholesterol and lower levels of the good cholesterol. So really high cortisol is actually quite detrimental. But the most important thing that high cortisol can do is it can actually impair your ability to learn. So really high cortisol, it interferes with your ability of your brain to be neuroplastic because it competes with another brain chemical called a trophic factor, a growth factor. And by competing with that growth factor, your brain cannot form those new connections to different neurons that happens as a part of learning. So when we think about cortisol, we think about it as being what we call an inverted U. So like if you don't have enough, you have trouble waking up, you're really low arousal. If you have too much, you can't learn, you're super stressed, you're anxious, you have all those other negative things happening. So you want to have kind of this just right amount of cortisol. And so that helps you to be in an environment that's very healthy for learning. The other thing that persistent cortisol does is it atrophies those memory structures in the brain that we were talking about earlier, the hippocampus. It actually causes it to shrink. And that reflects the direct learning loss that comes with high levels of cortisol. So maybe I will just finish on this last slide because now I've told you about cortisol. We're very good at managing cortisol, and there's lots of relatively simple things that we can do. So people who practice any form of meditation tend to have much lower levels of cortisol and be more adaptive at responding to stressful situations. So I should practice meditation, and I don't, so I just want to own that. Exercise is my cortisol remedy. So if you exercise, your cortisol spikes while you're exercising, but it rebounds and is much lower. And you can exercise in any way that you like. You can garden, you can clean your house, and if you want to clean a house, come to mine. You can walk, you can run, ski, bike. It really doesn't matter. Any form of exercise tends to be really helpful for cortisol. There's some really nice work by some of my colleagues at UBC looking at mindfulness. This work is in children, but it applies in adults as well. So if you participate in any kind of mindfulness program, you see lower cortisol, more empathy, more optimism. And then lastly, this maybe is where the easiest place to start, is if you get 6 hours of sleep instead of 8 hours of sleep, you see almost a 50% increase in cortisol in your bloodstream. So sleep seems to be a really important part of this kind of cortisol management strategy. Yes? No, I'm sorry. 8 is much better than 6. So 6 hours of sleep increases cortisol by 50%. Yeah. So that would probably fall within the part of the meditation strategies, deep breathing, and that can be very helpful also. Yeah. Yeah. Yes.
So what is the connection between loss of neurons and dementia?
So in dementia, we do see losses of neurons, but it may not be a direct relationship. The first thing that happens in dementia is our neurons tend to become less organized. They become what's called tangled. So, yeah, I wish I knew. We could, like, yeah. Why? Why would that happen? I don't know. And this is the trick of dementia is people, we can't figure out why. That, like, is the tangling the reason, or is it a secondary effect from something else? So there's kind of a big reckoning in the field of dementia right now, in that we've studied it forever. We have all these drugs, and they don't make much of an effect. They're very small effects, right? So the ideas around the why are really being re-examined. People kind of trying to really rethink what's happening. I work with some folks right now who are thinking a lot about proteins and how they're misfolding in dementia. They become almost convoluted, and that may be a trigger for all these other downstream things. But people are kind of trying to come back and develop new hypotheses for the why, so they can develop new interventions. You see plaques as well, and then you see a loss of neurotransmitter. And we've developed interventions that reduce the numbers of plaques, but it doesn't affect the dementia behavior. So that suggests that's not the why, right? So it's a real frustration in that field right now. It's not my expertise, but if you want to have an expert in that area come and speak to you, I can suggest some of my colleagues.
That's a good idea.
Yeah.
Thank you. I want to pause here. I know there are lots of amazing questions that we could ask. So I just want to give a big round of applause. Thank you so much, Dr. Boyd.
Absolutely.
That was wonderful. I know I learned a lot, and I'm sure you all learned a lot as well. And just thank you so much for coming.
welcome.
I kind of want to
Yeah.
go and have my own brain scan now and see.
We are recruiting.
There you go.
So if you are, I was just going to come back. If you have a question I didn't answer, you think of something later, I may not know the answer, but I can try to direct you. But you're welcome to email me. It's very easy, first and last name @UBC. I'm easy to find on the web if you want to look for me there. I don't really do social media, so don't look for me there because that's all just awful and horrible. I don't do it. But if you are interested in a study, and we are always recruiting for folks who are interested in different things, so let me know. I can't just give you one, but if you want to be in one of my studies, it can be arranged.
Sign up for a study.
Sign up for a study, yeah. So we're not clinical, we're always under the auspices of research. But if you are interested in participating in a study, we have to have volunteers to make it all happen. So you're welcome to email me and we can have a chat.
Wonderful. Well, thank you again so much for taking the time to be with us today. And if you need that email again, we will share it with you. You can ask me. I have it. Thank you. We're going to bring out lunch, so you don't have to go anywhere. We're going to bring it to you unless you got a special dietary restriction meal, which is on the table here. Let's join together in Motzi, and then food will be coming to you. Baruch atah Adonai Eloheinu melech haolam hamotzi lechem min haaretz. Amen. Food will be coming in just a minute.